So we have been working quite closely with the state authorities in Kano. Over the weekend, we engaged directly with the state governor, and virtually over the last 2 days, I have been talking to people in Kano to find out what is going on. It's not very clear whether the reports that we're getting are actually factual or not, but they have set up a team that will be looking at investigating this further. In terms of what we are doing from the Abuja side, as you're probably aware, the DG and CDC has made an on-the-spot assessment yesterday. They just left Kano today. We've also sent rapid response teams to Kano. We continue to engage with the government in terms of testing. The test center in Kano started last week. We are also looking at opening more centers for sampling, for taking samples.
Welcome back. Yes, indeed, still keeping our focus on developments concerning how we're tackling the COVID-19 pandemic here in the country. But our focus starts from Kano. Today, we've got Dr. Sanusi Bala, who is the chairman of the Nigeria Medical Association, Kano, who joins us from our studios there. Good morning, and thank you for joining us today.
Good morning.
All right, now different news, information, different items making the rounds coming through from Kano. We also did hear the PTF COVID-19 speaking yesterday to journalists, the country, about how they intend to be more aggressive and focused or give more attention to Kano regarding some areas. But in terms of the mood, how people are responding, the activities concerning COVID-19 in Kano, how would you describe it?
Actually, people are complying when you come to the major public areas, the roads, markets, and so forth. But right when you go into the community, that is not the situation. It's entirely different. The youths are playing what is they call Corona Cup tournament, and you find people sitting around, no social distancing. And definitely there is need to extend the lockdown into the communities.
Okay, well, we're trying to see how we can get to hear you a lot better, just working on some things here. But if you could talk about, you know, my apologies now, I might have missed some part of what you said, just some technical things going on. You say that the youths are playing what you describe as Corona Cup. How is that? Because there's supposed to be lockdown in Kano, isn't it?
Yes. But actually, they still do it. They find their own way of doing it. I think the security personnel probably must have concentrated on the major roads, the markets and other places, and they did not focus into the community.
That would say then that there aren't government officials out there enforcing the lockdown at all in Kano.
Actually, they are around, but from the situation on ground, they may not be adequate in number. And then Kano is quite a very big city, and then you have a lot of streets and clusters and high density population.
Earlier on, you said, well, the rural areas are a major source of concern for you. You talked about the communities, and it begs the question, if there seems to be some form of, you know, I mean, if people are going along with the lockdown in the urban areas, why do you think the communities are different? Is it that they're not getting the message, or they don't even think the message is true? What do you think is responsible for that?
Actually, I think the means of communication, one, matters. Because mostly social media, television, these are things that are not available in some of these places. Other factors are that Kano, some of the religious leaders did not really agree with or believe in the coronavirus spread, and as such the information going around is different. And you have also some kind of propaganda, I don't know, from the political arena or what it can be, but many people are not really complying because of misinformation and so forth.
It's because you are just going through some technical challenges here. We didn't hear a lot of the last part of what you said. The viewers may have heard, but apologies, we didn't. But let me roll this tape again. This social media video of what's going on, and then how you reference the Corona Cup. So if you look at those clips, if you can see that, is this what you're talking about them not being aware, or at least exhibiting the fact that, look, this social distancing is supposed to be the norm now, especially as the world is grappling with this coronavirus? So is this what you're talking about? And if it is, are the authorities aware of this? Do you know if they're doing anything about this?
Actually, in Kano, more needs to be done. And it needs to be done from different dimensions. And using the traditional rulers, going to grassroots, the religious leaders, the government, and then the law enforcement agencies have to go down into the community and engage these individuals so that they will agree and also see the challenges that is facing us.
This to say then, Doctor, that the Kano State government is either not aware that this that you have just told us about, and which many people have also seen, they are not aware of it, or that, just as you said, the security operatives who are supposed to be enforcing the lockdown are not enforcing the lockdown, or, just as you said, are not enough. What then would you say, especially to the people who may be watching you now, about this whole coronavirus thing? Because it would seem, I don't even believe that it exists.
Hello, pardon? Can you not get your last words?
I said, what would you say to those who may be watching you at this point, who may not be aware that this whole thing is really, really as real as you in the medical profession and many other people all around the world are seeing it? What would you be saying to them? Because it will seem like government is either not aware that what you have told us about, which we have also seen, is ongoing, or that the people are even aware that they are putting their lives at risks. What kind of communication should be going out to the people?
Actually, the video that you showed have said it all and had proved what we said. And from different dimensions, I think effort is being made. But it's not enough, and more need to be done.
Advice to be done, if there is more to be done. What is it that haven't been done, which needs to be done from your words?
The communication down into the community using the traditional rulers and involving also the religious leaders, then also trying, because one must believe in the first place for him to be committed and also stay under the lockdown. But if you feel that you cannot force someone, yes, security operative can be enforcing it, but at the same time you need to have a kind of engage these people for them to understand, agree, believe that this is real, and then block all propaganda, video and other ones that are going and misinforming the population.
You are aware that the Kano state government has declared a lockdown, and there's even a law to the effect of fighting this pandemic, this infectious disease from spreading in Kano. Is it to suggest, are you suggesting then that the Kano state government didn't particularly carry out the citizens, the indigenes, and the religious leaders, just as you have said? Is that what you're saying?
That was done, but it appears not to be adequate. It needs to be done more. And then it needs to be done at the grassroots, because most of these people may not be able to be carried through the social media. You cannot reach them, and some of them television also, you cannot reach them, but you have to go down through the traditional way.
Now, the Kano State's COVID-19 updates indicate that the total confirmed cases are 73, none has been discharged, and then one death has been recorded as that's the updates coming through from Kano. But then, there are reports making the rounds as well, and talk to us about it, where it says in the last 2 to 3 days that Taroni, they say there's some burial going on there, about 40 people in the cemetery. And then they also talked about Ndolo, which had about 35 people. So those reports are really circulating even beyond Kano. What do you know about those reports?
Yes, I have heard about, we have seen it, we have analyzed it. But whether we like it or not, we have to believe the cemetery attendants and the undertakers, because there is no mechanism to which the government is keeping vital statistics. And if you want to argue, you have to argue with statistics of your mortality, but we don't have that. So, and false reassurances are not what we can accept at this stage. What it needs to be done is that, as a matter of urgency, is to get these statistics right and then monitored, and then we look at it, analyze, and we take action.
Wait, does that suggest then that the figures that the state governments are putting out about either total confirmed cases or total death cases should be revised?
You cannot revise that based on the mortality, because there are no tests done on those cases to confirm whether they died because of coronavirus or not.
So let me just backtrack a bit. I mean, because this came out and shocked a lot of people, but you have been on ground for a while. Has this ever happened? Is this a trend? Is this something that happens often, or this is somewhat different from what you have seen in previous weeks, months, maybe years?
NMA Kano doesn't keep vital statistics. That's supposed to come from the state government. In the event that the state government confirm that they don't keep that details, then, as I said earlier, what is available is what we take.
From your experience as a medical practitioner in Kano, is this normal?
I'm not getting you.
I said, from your experience as a medical practitioner in Kano State, is this case normal?
Actually, this figure that was given, if it's true by the undertakers and the attendants of the cemeteries, then definitely something is happening, and as we have said earlier, it must be investigated, and we must know what is coming out of it. What is alarming to us is what we see in the hospital. Though less people come into the hospital, but the point is that our testing capacity in Kano is not adequate. Most cases that come to the hospital, you see them with clinical features that you want them to be tested, but then the rapid response team is not on ground or they don't respond on time. This is one reality we know that is challenging us, and it needs to be reversed, and we have to find a true rapid response team in Kano, in which when you give a call, they come down and take samples. That is when we'll be able to have our figures right, and everybody will be able to talk with confidence that this is what we have.
Because that report came through on the 20th of April, and it did say that 100 people died in Kano from what they described as strange illness. Now, several articles circulating also indicated that, well, these reports from many cemeteries that the authorities initially denied but said, okay, well, we will go ahead and investigate them, and that they were affecting mostly elderly people who were not able to get care, and so this eventually happened to them. So from your professional perspective, first you say, well, they need to go ahead and contend those figures, or take a look at it from the cemetery's perspective, those figures. But in terms of why and what may have caused it, well, are there any reported cases that spiked in the hospitals that your colleagues, yourselves attended to? Any such thing going on?
As for mortality, we don't have any report as it is now that there are some particular cases or so forth. But what is happening, we know that there is rise in acute febrile illness from our outpatient clinic and also emergencies. Percentage from what we got from 3 different hospitals, including a tertiary hospital, showed that 60 to 70% that just come with acute febrile illness, and about 50% of them positive for malaria. Those others may be other things. Though it's not uncommon in Kano for you to have rise in acute febrile illness, some due to malaria, some to respiratory tract infection, and some other said to be from dengue fever.
Isn't the standard practice to test them? Because if you look at the case definition from the NCDC, you see that, people that have fever or cough or difficulty breathing or have had contact with someone with the virus should be tested. Now, if you say that they've had, these symptoms, perhaps fever or, respiratory, symptoms, isn't the standard practice to test them? And how well have those tests been happening?
This is where we have the missing link, because the rapid response team has not been rapid. And in most instances, they come after 24, 48 hours. This we have complained, and we are hoping for this trend to change, and then more kits to come down. And that's why we are happy with the presence of NCDC in Kano, so that together with the task force will now galvanize forces and will give us more testing capacity, so that any patient that our members feel to be tested, that patient will be tested, and the turnaround time will be reduced. This will help to now rebuild and give us the actual situation.
So if you say that this team has not been rapid enough, I mean, there's 24-hour, 48-hour gap. So there's a possibility that, some of your members may have come in contact with patients who are potentially positive. Is that a possibility you're considering? And how well protected are you?
Already it has started happening. Yesterday, I received complaint of a number of doctors that have symptoms, fever, respiratory tract infection. And as I'm talking to you now, it's so sad to mention that there are still some that their sample was not taken. I communicated to the coordinator myself and raised this concern, but this was not rectified. And for protection, is, I think, a number of hospitals have to raise the possibility of withdrawing their services before now stores are open and we are getting the protective gear. We are monitoring the situation to make sure that every member is well protected, and we have made it very clear that there is no emergency in pandemic and nobody should rush or try to be heroic in attending to a patient, high-risk patient, without having this protective gear.
No, if Kano, because I'm looking at the figures, Kano has recorded over 70 cases. It took Lagos over a month to record those cases that Kano has recorded in just space of about 10 days or thereabout. So we see that the trend here is really dangerous. But you say that there's a possibility that, some of your members might even withdraw their services. So if you have escalated this, who did you talk to? What response do you get? I mean, that's something we don't want to happen. So tell us, what response have you gotten so far?
The response we got from the task force is very poor. We have communicated with them. In the first instances, the communication is just one way. You give information, and when you try to make your input so that we work together, it was very poor. And at the same time, in most instances, you can't get someone through in that. We have passed our communication, and I have received about 5 different letters that was passed from the affiliate to their employers. And at the level of the task force, we have communicated with them, but the response we are getting is totally zero.
Another thing we've talked about is, I mean, this is really shocking, by the way, to hear this, because you're at the front line. This is a major war that we need cooperation to win. But we also hear about, the capacity of Kano State to handle a potential outbreak. What do you see in that light? How well prepared is Kano?
Actually, I have said it several times that preparation for COVID-19 can never be optimal. But when we started seeing cases in Kano and looking at it, I think the preparation started when we started seeing cases. What has been happening from the task force is more of theory rather than action.
I'm sorry, when you say more of theory rather than action, I mean, we've seen time and again the meetings, the deliberations, the pronouncement. Just recently, the governor signed that law to at least make sure he curbs this by whatever means is possible. So when you say theory rather than practice, what do you mean?
You can have plans on papers. You have a lot of things, though I always reason probably with the committee that Kano has never handled a situation like this, unlike other states that handle Ebola and so forth, and probably they underestimate the population of Kano. But the reality as it is that what we see on ground did not reflect the assurances that we got from the committee.
From your professional perspective, given what you've seen, are you optimistic, or how concerned are you concerning how Kano is responding to this COVID-19 case?
Actually, we are so much disturbed. But then with the coming of the NCDC and working control, probably we are hoping to see things change. But the major thing we keep saying is that you must have a kind of quality control. You must have checkpoints in which you look at what you put on paper. When it comes to implementation, those things are going well. People become frustrated when you make calls and nobody come forward. And then there is no kind of quality control or check, whereby you get that these calls and the rapid response were on ground to do these tests, and then at a level you have no test been done. And in fact, it's just frustrating actually. But we are now developing confidence that the employers are giving out protective gear, and also the NCDC is coming, and we want them to galvanize forces, and so that they will truly investigate these mortalities in the first place, and at the same time will win the confidence of the health workers by being rapid in their response and also having a very good feedback.
Well, we'll get a little more, we'd like some more specifics from you concerning what you mean by having that quality control and then matching what you have on paper to action. But that will be when we come back in just a moment. Stay with us. Welcome back. Our concluding moments now with Dr. Bala. So could you tell us, when you say you like them to match action with what they have on paper with the reality, and then you say you want to see a situation where people call and then people come forward, and as opposed to when they call and people don't come forward, could you be a little more clear about that? What do you mean? Who's making the call to who and who's not coming forward?
Just as you have in NCDC, there are numbers in which you will call when you have suspected case of COVID-19. But where we have this lag is that you make a call and you expect a connection between the call room and the rapid response team. And then the rapid response team should go by their name as rapid by coming up to come and take sample of that patient, quarantine the patient, and until the result is ready, and you decide what you do with that patient. But what is happening as it is now, you make communication as a doctor or someone in the community, and then the right team did not reach to you for over 24, 48 hours, and you are waiting. What will happen? Finally, you may have these cases going back into the community, or at the end of it, giving more risks of infecting others.
Do you have any
experience? What I mean by this
Okay, so do you have any personal experience about what transpired or what you just described?
There are a lot of them, and I just finished telling you I have a doctor that have these symptoms suspected. We have made all the communication, and finally I personally called the coordinator 24 hours ago, and his samples was not taken.
Cool. So it also begs the question, I mean, how represented are you on the state's task force? Because if you have enough representation, that you probably know what's happening inside, how to make it better. So how well represented are you on that task force for the state?
NMA Kano is not part of the task force. The only meeting we had with them when they called us to communicate for our members to participate in the front line. And even that, as I said, it was one way, because the observation we made was not implemented, because these doctors, by best practice, after seeing the cases, they are not supposed to go back to their families. They are supposed to either stay in a hotel or so. And after like 2 weeks or so working, these people are to be taken care of before they go back, and you now shift post with another team. But as it is now, since we started, they are the same team working, and apart from that, their morale was down because there was no risk allowance, no anything given to them. In fact, some were even coerced to report to the center. This is one of the only meeting we had with them, and all our discussions was not implemented.
So could you tell us some of those recommendations that you said you made which were not implemented?
You see, one of them is that you cannot have a doctor that will come and do this work and he will go back into the community every day. Or he will go out and buy food and have contact with other people. The risk for him getting infected is higher than the general population, and those people should be fully taken care for, transported from the center to a hotel or particular area, and they dedicate themselves to work in that place for a particular period. And for you to avoid fatigue, this will have another team to come in after that. And then you have to boost their morale. You must give rich allowance to these people. You must provide some hazard allowance, and you must provide some kind of life assurance. But all these things are not in place. They are things we raised by our representative during that one only meeting, but they were neglected, and this is telling on these workers.
Well, one of the things that a number of people would be concerned about, and I'm pretty sure your association will be concerned about it as well, given the population of Kano and the number of healthcare workers in Kano, do you think we have a sufficient number of healthcare workers to deal with the issues as they rise?
This is what we raised earlier also. And Kano, we still have young doctors, graduates that are looking for employment. These are a number of doctors you'll add to the workforce. If you look at other states that had the same population as Kano, and you look at the doctors we have in Kano, we have small number of doctors. And then we have raised it earlier even before COVID-19. Now, take Lagos, take Kaduna. These, they have 4 federal institutions in their states, and they have over 1,000 beds altogether from these federal hospitals that is supporting the state. But Kano have 1 teaching hospital and 1 mono-speciality hospital, the Ala Orthopedic Hospital, and if you put the beds all together, not more than 800. And so the support we have from the federal government is also small. And this is one of the things we raised, and the executive governor took it up to His Excellency, and we need this support definitely of increase in the number of doctors, and the state government must mop up these doctors that are unemployed, other health workers, especially nurses and pharmacists and so forth, that will support in this fight, because at this time no health worker you will allow roaming on the street while you need them looking at the population of Kano State. We have raised this thing, we have contacted, we have rubbed mind, but to date it's still on paper.
Okay, let's make it a little more expansive. We also have your professional colleague joining us from Kano via Skype as well, Dr. Mubarak Danjaro. Good morning, doctor. Thank you for joining us this morning on the program. Well, we've talked about some of these developments playing themselves out in Kano. What would your concerns be about how the state is handling the COVID-19?
Good morning. Thank you for having me. I think regarding what the state is doing, I can't say the state is doing enough, but I think there is still room for improvement. There are a lot of areas that actually need improvement. For instance, the provision of personal protective equipment, PPEs, are not actually available to doctors and other health workers in the states. And I think in Kano, now we are the third state based on the number of COVID-19 patients in the whole nation. And we still have only one testing center. I think that also is a challenge, and that also is a challenge on its own. And also regarding the lockdown, I think the level of compliance initially was good, but I think as the week was rolling by, the compliance level was decreasing, and I think even the security officials, they are getting fatigued or something. I think even though the state government looks to be doing a lot, but I think there's still need for improvement in many areas.
Well, talking about preparedness of the state, in your opinion, as a medical practitioner, do you think the Kano state government had enough or significant preparation to tackle this case?
Well, I wouldn't say they have enough of significant preparation. I think the preparation of the state is fair. I can say it's fair at best. I wouldn't call it significant preparation at all.
Proactive or reactive, where you're coming from?
Come again, please.
Do you think the preparation of government in Kano was proactive, or the government is being reactive as the issues unfold?
I think the government is very active.
Okay.
Well, that's not quite what we hear from the NMA chairman. I mean, saying that, you know what, so far it seems as though it's a one-way communication for them. They give the government's information and recommendations, and so far those recommendations have not even, been put in place. And you say that you think the government is active. So where is the missing link here? Because you are a medical practitioner. He says that the morale is not as high as it should be. He reeled out, which I'm sure you heard. So is that still really the case? You think that government is being active if doctors feel that the morale is low and things could be better?
Yes, I agree with the NMA chairman. The NMA chairman already gave recommendations to the government. Several recommendations were given to the government. And I think when those recommendations will be implemented, I think it will go a long way to improve the responsiveness of the government. Like when the doctors or other health workers know that there's a hazard allowance for them, they're more likely to do their work with due diligence. And when they know that safety, the safety of their families is assured, when they don't have to get back home, when they have enough personal protective equipment, they are more likely to do their work with more morale. And yes, I on that case, I agree with the NMA chairman that the government needs to look into the recommendations of NMA as an association, and we need to improve on the government responsiveness as we are now.
Okay, I'd like both of you to listen to this, then we'll come back and get your response on it.
You must ignore the vaccine being hawked in Kano, which is called COVID-19 vaccine. It's yellow in color. It is not certified by anybody. Please don't patronize the hawkers. The campaign has therefore continued to focus on the need for the populace to adhere strictly to social distancing and mass gathering restrictions. Wear face masks and ensure group personal hygiene. The next phase of the public enlightenment and advocacy campaign is to develop and disseminate IEC materials on the need to avoid stigmatizing those who have contracted the virus, the need to shun fake news, and the need to reach those who are visually challenged or hearing impaired. We have already started working on this.
Well, Dr. Danyaro, you initially said that the awareness was there, but at some point it dwindled. Could you tell us, how did they come to this, such that people believed that they could buy a vaccine such as that?
I think Kano is a state that has always been a place where traditional herbalists, they have a very big market here. So I wouldn't think it's a surprise, because even though there have been a lot of awareness campaigns, but still people believe in these traditional herbalists or traditional quacks. I think even though a lot is done, but some people already believe in those things, and I think more has to be done. Some people don't even listen to the radio; they already have their own beliefs. So I think it will be difficult, but it can still be done when awareness is being, maybe awareness campaigns are being done maybe in the native language of the people of the states.
So have you actually seen these vaccines? Do you know anyone who has taken any of such? Have you attended to anyone? And what's their thinking if you have?
No, I've not seen any patient who has actually purchased this safe vaccine.
I mean, I'd like to relate this. Right. I'd like to relate this to the earlier discussion we had about the deaths, the very, very scary deaths that we have seen, the figures in Kano State. Do you think there's maybe a link between, COVID-19, maybe some of the traditional practices you have talked about, and the spike in the number of burials which have been reported in Kano State?
Yes, I've heard it on the news. It's all over the news that there was surge in the number of deaths in the state. However, we cannot actually confirm that there was actually an increase, because for you to say that there is an increase, you must have had a benchmark data. If you don't have such data, then we may not see for sure that there has been actually an increase. The state government, through the Ministry of Health, assured that they will use the state epidemiologists to conduct a formal survey to ascertain this. If it were true that there were actually increase in the number of deaths, there are a lot of factors that could have caused this increase in the number of deaths. Firstly, in this COVID-19 pandemic, most people are afraid to go to hospital to seek medical care, because they know hospitals are the foci of COVID-19 transmission. And secondly, most of the private hospitals in the states are not functional. And so even the government hospitals are mostly now concerned with emergency cases. And so the patients and people may not present to hospital unless their case is very severe. And also the lack of the absence of commercial vehicles roaming around in the city also may pose another challenge. People may not get an easy access to the hospital if they don't have a private vehicle. I think if it is, the number of cases have to be confirmed first, because they are just sporadic reports and they cannot be depended on. But if epidemiologists confirm that there was actually an increased number of this, other explanations, there are other things that could explain this. And we are in April, we are about to celebrate the World Malaria Day in the 25th of April. In this month, usually we have a surge in the number of malaria cases, and I think this also might contribute to the number of cases. And according to these reports, most of the patients that died, they are elderly patients in their 70s. These patients usually have other background medical conditions that may not necessarily mean it's COVID-19. And you see, in this pandemic, coronavirus pandemic season, people are very hyper-vigilant. Any small thing, they are likely to be paranoid and ascribe it to, they try to link it to COVID-19. So in conclusion, we wait until the state epidemiologists conduct a survey so that we can have a tentative say whether there's actually been an increase in the number of cases, deaths in Kano. And if there are, then what is the actual cause of this surge in the number of deaths?
Speaking about those cases, the deaths and the reported cases as it were, we also did receive this video, the social media video, which we've not been independently able to confirm as of yet. But this is said to be another one of burial ceremony in another of one of those cemeteries where people are burying, unfortunately, their loved ones here. So have you seen this sort of video? What can you tell us about this? Daniel, can you hear me?
Yes, I can hear you. Which video is that?
Well, there's a video of residents in Kano who are going to the cemetery to bury some of their loved ones. And so the video is circulating on social media. We also did receive that video. Are you aware of such cases, and how do you think that should be approached?
I think it's maybe a case for concern. It's the concerns by the people should be a trigger for a standard statistical survey to be conducted by a state, Swiss epidemiologist. But I think paranoia is at play. Also, it may contribute to some of the anxiety of the people. Because most people right now are at home, so they're they're very hypervigilant. Any small death reported is overanalyzed, and since they're at home doing nothing, they're likely to notice every single death that's occurring around them. Unlike before this coronavirus lockdown, when everyone is busy with daily activities, people might not actually notice the number of deaths happening around them. But with this lockdown, every single death is overanalyzed. People are aware of every single death, and it's likely to be ascribed to COVID-19. And if I
right,
ask you before this,
let me bring in your colleague as well, Dr. Bala, on this. Dr. Bala, I mean, yes, you've spoken about the videos previously, but let me get your thoughts on those so-called vaccines that are circulating in Kano. Have you heard about it, and how come it's gaining so much traction?
Actually, we are not aware of it because it appears to be a traditional medicine, and in Kano there is that challenge, a lot of traditional drug going around and in different places, and one will expect, yes, definitely something like that may come up. It's only up to the authorities to rise up to the occasion and make sure that such did not make people not to observe the actual social distancing, hygiene, and other things.
Well, let's get, gentlemen, both of your suggestions now in terms of what needs to be done to ensure that, look, the people of Kano get a lot more information. This is taken a lot more seriously because we also do have reports that some persons in the COVID-19 team are under some sort of self-isolation, unfortunately, so they think the coordination might be challenged. So what would you like to see moving forward?
Moving forward is that the action plan, what is available, should be implemented with all the inputs given. And two, there should be a kind of check at each level. One, at the level of the rapid response team, at the level of the caregivers and the isolation center to monitor what is going, have quality check, and also even at the level of the committee at some level, His Excellency should be examining their activities and have a kind of quality check, make sure that what is being done is being reported is what is actually on the ground. By doing this and having a feedback system, we'll be able to correct ourselves and make corrections where we have a kind of shortcoming.
So finally, if you could do this quick, do you see a lifting or an extension of the lockdown in Kano?
Kano, we must have extension, actually, because the aim of the extension, apart from reducing the transmission, at the same time there will be a kind of more intensive identification of cases, screening, and isolation. But then we have seen what had happened at the initial. Some members of the team, unfortunately, happened to be in isolation. It's only yesterday that we have a new coordinator to coordinate the activities of the team. So definitely we'll need more time so that they will do their job, and then at the same time improve their check and response, and we tends to develop a better coordination so that all suspected cases will be screened when due and then isolated, and we have things being put in place.
All right, thank you very much indeed, Dr. Sanusi Bala, Chairman of the Nigerian Medical Association, Kano chapter, as well as Dr. Mubarak Danyaro, who is a medical practitioner. Thank you, gentlemen, for joining us today on the program. We will be back in a moment. Join us again.